The ankle joint is made up of three bones. The tibia, which is a large, strong bone in the lower leg that forms the inner part of the ankle. The fibula, which is a smaller bone that forms the outer part of the ankle. And the talus bone, which is another small bone that sits between the leg and the heel bone, or calcaneus, in the foot. There are three main ligaments in the ankle, and their main role is to create and maintain stability. The foot supports the entire weight of your body, so it needs to be very stable. And thanks to these three ligaments, that is definitely the case. First, we have the anterior tibiofibular ligament, which connects the tibia to the fibula. Next are the lateral collateral ligaments, which provide stability to the outside of the ankles. And finally, there's the deltoid ligaments, which provide stability to the insides of the ankles. Number of tendons run through the ankle, attaching muscles of the lower leg to the bones of the foot and ankle. There are three main tendons we address in the movement method. The Achilles tendon, which attaches the calf muscle and the calcaneus. It makes up a large part of the calf and runs along the middle of the lower leg. The anterior tibialis, which runs down the front of the leg to the foot, and the posterior tibialis, which runs down the back of the leg to the foot and helps to maintain the foot's arch. The foot and ankle work together to form the foundation of most human movement, and their ability to establish stability and transfer kinetic energy to the rest of the body ultimately has a large impact on performance. There are four main movements of the foot and ankle. Dorsiflexion, which is flexing the foot up toward the shin. Plantar flexion, flexing the foot downward toward the floor. Inversion, moving the foot inward and downward. And eversion, which is moving the foot outward and upward. Any biomechanical dysfunction in the foot or ankle will severely impact how a person can perform in certain activities or sports. For example, a basketball player that experiences a sprained ankle will be severely limited in ability if not removed from the game. A sprained ankle is the most common cause of ankle pain. It's an injury that occurs when you roll, twist, or turn your ankle in an awkward way. This can stretch or tear the ligaments that help hold your ankle bones together. As we discussed earlier, ligaments help stabilize joints, preventing excessive movement. A sprained ankle occurs when the ligaments are forced beyond their normal range of motion. Most sprained ankles involve injuries to the ligaments on the outer side of the ankle. Signs and symptoms of a sprained ankle vary depending on the severity of the injury and include pain, especially when you bear weight on the affected foot, tenderness when you touch the ankle, swelling, bruising, restricted range of motion, and instability in the ankle. Plantar fasciitis is the most common cause of foot pain. It involves inflammation of a thick band of tissue or fascia which runs across the bottom of your foot and connects to your heel bone to your toes. Plantar fasciitis commonly causes stabbing pain that usually occurs with your first steps in the morning. As you get up and move, the pain normally decreases, but it might return after long periods of standing or when you stand up after sitting. Plantar fasciitis is more common in runners and people who are overweight. It can also be caused by wearing shoes with inadequate support. Plantar fasciitis is usually accompanied by weak glutes and lower back and neck pain as well. Working on the thoracolumbar fascia in the mid and low back and posterior tibialis, as well as the plantar fascia, is extremely helpful in relieving pain and other symptoms associated with plantar fasciitis. An injury to the ankle or foot will definitely impact the movement chain and ultimately your movement patterns. Looking at this illustration, you can see how an injured ankle or foot could affect several other muscle groups and joints, causing pain and dysfunction as far away as the opposite shoulder. When your brain senses pain, it automatically and subconsciously and consciously moves your body away from it. This in turn causes other muscles and joints to compensate for the dysfunctional movement. In my practice, I see many people who complain of shoulder, back, or hip pain, and they often say has no cause. I didn't hurt it or strain it. I don't know why it hurts. I usually ask if they have or have had a foot or ankle injury, and guess what? In most cases, they have. So we need to consider the whole body in our sessions and treat not just the root cause, but the underlying issues as well. The foot and ankle serve as a point of contact in locomotion or traveling movements, such as walking, running, or jumping, and as the foundation for all standing movements, such as throwing a football, punching a heavy bag, or performing many different weightlifting exercises, including the squat and deadlift. Dysfunction impairs performance, and subtle biomechanical dysfunctions or deficiencies can impact coordination, balance, speed, power, and agility. A lack of stability in the foot and ankle will negatively affect performance. For example, a soccer player's lack of stability in foot or ankle will slow down the speed in which they can change directions. Consequently, the delayed response in this athlete's attempt to change direction will allow the other player to get past them and possibly score. For non-athletes, a foot or ankle injury will impact walking, running, and overall balance and coordination required for efficient movements throughout the day.